on your bed, tossing around to get comfortable so that your body and mind can rest at peace. Staring into your dark room, watching the clock go minute by minute and hour by hour, just hoping that you will fall asleep soon. If yes, you are currently dealing with insomnia. Do you know what is insomnia? So, before we start, let me briefly introduce myself first. I am Siti Humaira binti Abdul Halim Eng from class MBA 118-3E. So, I hereby to inform you about types of insomnia. So, like what I asked earlier, do you know what is insomnia? Insomnia is a common sleep disorder in which you may have trouble falling asleep, staying asleep, or both. A person who dealt with insomnia always didn't get the recommended amount of sleep, which is at least 7 hours every night. One might think that not falling asleep or wake up too early and not be able to fall asleep back are just small matter, but do you know that it can affect your health, work performance, and quality of life? Insomnia is divided into two types, which are short-term insomnia, chronic insomnia, and you might even hear about terms to describe insomnia, like such as sleep onset insomnia, sleep maintenance insomnia, early morning awakening insomnia, mixed insomnia, and comorbid insomnia. Now I will show you the short video of insomnia. So now I will share to you about type 1 insomnia, which is short-term insomnia, or known as acute insomnia or adjustment insomnia. This type of insomnia tends to last from a few days to a few weeks and basically less than 3 months. Short-term insomnia often caused by a stressful event like the loss of loved one, disconcerting medical diagnosis, a pandemic, rebounding from cessation of a drug or marijuana, or a major job or relationship change. The other potential cause that can lead to short-term insomnia are changes in noise, lighting, temperature, or other condition of sleep environment. So let me give you an example. When you often sleep in a dark room with cold temperature, you might be having a trouble to fall asleep in a bright room with warm temperature. And another cause is because of the usage of caffeine. When you drink a cup of coffee while doing work, there is a tendency you may not be able to fall asleep, as it helps to refresh your entire body, especially your brain. The common symptoms of acute insomnia are difficulty to falling asleep, difficulty to stay asleep, early morning awakenings, fatigue or daytime sleepiness, poor attention or concentration, social or vocational dysfunction, mood change as you often worried, unmotivated and less energy, and lastly, you frequently deal with headache, tension or stomach ache. Now, let's move to my second point, which is type 2 insomnia, or known as chronic insomnia. Chronic insomnia is a long-term pattern of difficulty sleeping. Insomnia is considered chronic when a person has trouble of falling asleep or staying asleep at least 3 days, 3 nights per week, or more than 3 months. There are two main types of chronic insomnia, which are primary insomnia and secondary insomnia. Primary insomnia means that your sleep trouble isn't because of your health condition, but while secondary insomnia means that you have trouble sleeping due to your health conditions such as trauma, emotional stress, and ongoing health problems. Chronic insomnia can cause symptoms at night as well as during the day and can interfere with your ability to go on with your daily tasks. Symptoms may include trouble falling asleep, waking up through the night, trouble staying asleep or returning to sleep, waking up too early, daytime sleepiness or grogginess, not feeling rested after a night's sleep, mood change such as always feeling depressed, difficulty concentrating, problem with memory and lead you to be more careless or increase in mistake and accident. So I want to highlight that the symptoms of chronic insomnia and acute insomnia might be similar, but please take note of the duration. Remember that acute insomnia only happen for on few weeks, but chronic insomnia happens for more than 3 months. For my last point, I will share about ways to treat insomnia. Short-term insomnia often gets better on its own, but for chronic insomnia, you might have to meet a doctor, and your doctor may recommend cognitive behavioral therapy or known as CBT. This treatment has been proven to be as effective or more effective than sleep medication in treating chronic insomnia. It involves educating you on better sleep habits while helping you to change the belief and behaviors that interfere with your ability to sleep. Some of strategies of CBT that are specifically focused on insomnia is known as CBT-I. This is cognitive techniques by using journaling to write down your worries or concerns before going to bed. Next is relaxation techniques, which is such as breathing exercise, yoga, guided meditation, and other techniques are used in order to reduce muscle tension and control your breathing and heart rate so that you are able to relax. So we have come to the end of my speech. Today, I have informed you about the types of insomnia, which are short-term insomnia and chronic insomnia, and the treatment. So, I hope anyone who are currently dealing with insomnia, please immediately detect your types of insomnia, and if you are handling chronic insomnia, you are advised to meet a doctor to treat it for a better outcomes. So, that's all for me. Thank you for watching. I hope you enjoy my speech. Thank you.